Welcome to Human 101. I'm Dr. Synapse. Today we're breaking down why your heart sometimes feels like it skips a beat. You are sitting there minding your business. Then suddenly, your heart does a weird little thump. Maybe it feels like a flutter. Maybe it feels like a pause. Maybe it feels like your heart flipped over for half a second. Most of the time, that feeling is not actually your heart stopping. It is often an extra heartbeat. Here is what is usually happening. Here is what is usually happening. Your heart has its own electrical system. That system tells the heart when to squeeze. Normally, the signal starts in the upper right part of the heart, in an area called the sinus node. The sinus node is like the heart's natural pacemaker. It keeps the rhythm steady, but sometimes another area of the heart fires a little early. That early beat can come from the upper chambers, called the atria, or it can come from the lower chambers, called the ventricles. When an early beat comes from the atria, it is called a PAC. That stands for premature atrial contraction. When an early beat comes from the ventricles, it is called a PVC. That stands for premature ventricular contraction. After the early beat happens, the heart may pause for a moment before the next normal beat. Then the next beat may feel stronger than usual. That strong beat is often what people notice. It feels like the heart skipped, paused, then gave one big thump. So the skipped beat feeling is often not a missed beat. It is usually an early beat followed by a short reset. Now, why does this happen? Common triggers include caffeine, stress, poor sleep, dehydration, alcohol, nicotine, some cold medicines, and even intense exercise. Your heart is sensitive to your nervous system. When adrenaline rises, the heart can become more jumpy. That is why palpitations often show up during stress, anxiety, or after too much coffee. For many people, occasional skipped beats are common, happen in healthy hearts, and are often harmless. But there are times when you should not ignore them. Get checked if skipped beats happen with chest pain, shortness of breath, fainting, severe dizziness, a racing heart that will not slow down, or if the episodes are new, frequent, or getting worse. Doctors may check an EKG. They may order blood work. They may check thyroid levels or electrolytes, and sometimes they use a heart monitor to catch the rhythm when symptoms happen. The big idea is this: a skipped beat sensation is often your heart firing a little early, then resetting. It can feel dramatic, but it is not always dangerous. Your body is full of electrical timing systems, and sometimes, even a healthy system has a little hiccup. This is Human 101. Next up, we'll explain why your heart races after caffeine.